Hello, my name is Stephanie Riato. I am a student at Purdue Calumet University. I am studying biology courses so I can apply to pharmacy school in the fall. I am very interested in medicine. Therefore, I'm going to discuss the impact of birth control and birth control methods on pregnancy and STDs. The following information is for teens and parents who are interested in knowing the consequences of sex for young teens and the preventative measures to help. Finding out that you're pregnant can be very exciting, or it can be the last thing that you want. For many teens, this new life can make a huge impact on their young lives. Birth control is the practice of preventing pregnancy and STDs. If that is the case, why doesn't more teens use birth control? There are a lot of myths about birth control use. Some teens believe that it is wrong. Some teens believe that it will affect their physical health, while others believe that it is just unnecessary. In a lot of cases, these mindsets are wrong. Let's explore why birth control is important and how it has such a positive effect on preventing pregnancy and STDs. Also, the exploration will include the truth about the negative sides of birth control. At the fragile age of a teenager, a lot of things are unknown. This includes the topic of sex. There are many myths concerning sex. Some myths include that when two people have sex for the first time, the girl will not get pregnant. According to the authors of the book, Predicting Young Adults' Risky Behavior, many young teens do not know that unprotected sex at any time can lead to pregnancy. Furthermore, every time there is an unprotected act of sex, there is an 85% chance that the girl can get pregnant. Not to mention, if one partner has a sexually transmitted disease, it is 100% effective that the uninfected partner will contract it. With that said, let's divulge into the world of birth control methods and talk about the best ones for preventing pregnancy and preventing STDs. There are many types of birth control methods available to young adults. Some of these methods include oral contraceptives, condoms, diaphragms, vaginal rings, and the ever-so-hard-to-do abstinence. Some of these methods are more effective than the next in preventing STDs. However, they all prevent pregnancy. Therefore, if teens choose the right method for them, they could be protecting themselves from pregnancy and STDs altogether. According to the author, Addressing Misconceptions About Birth Control, the most effective and highly used forms of birth control are oral contraceptives and condoms. In preventing pregnancy, the best method a woman can use would be oral contraceptives. When taken right, it makes it 99% effective. This is because it works via hormones. The pills release two hormones, estrogen and progestin, in order to stop ovulation. This tricks the female body into thinking it's pregnant, therefore does not release an egg during ovulation. It is important to know that oral contraceptives are not effective in preventing STDs. They are just the better choice for preventing pregnancy. As noted, there are negative side effects for using oral contraceptives. Some of these general side effects include nausea, blood clots, and cardiovascular disease. Each oral contraceptive has its own side effects. It is important to consult a doctor. He or she will be able to choose the right one for the specific person based on blood work and a physical. According to the book, The Safer Intervention, in 2009 it was reported that the oral contraceptives taken correctly has lowered the number of teen pregnancies by 50%. This is a great way to fight off teen pregnancy. However, this may conflict with the moral beliefs of some teens and parents. Another issue young adults face in the troubling years of raging hormones is STDs. STD stands for Sexually Transmitted Disease. As the name implies, these diseases are transmitted through sexual activities of any kind and can infect any part of the body. Some STDs can be medically treated while others will stay with a person for a lifetime. Some of those lifetime STDs will just be a flare-up while others could take your life. It is important to know what kind of STDs are out there and how to protect yourself. There are many STDs in the world just waiting to attack. Some of these include gonorrhea, chlamydia, and AIDS. According to Steve Zajanik, the most popular among teens are gonorrhea and chlamydia, while AIDS is actually a worldwide epidemic. According to the book, Talk About It, gonorrhea is caused by the bacteria Neisseria gonorrhoeae. Anyone who has any type of sex can catch gonorrhea. About half the people infected with gonorrhea are also infected with chlamydia. The infection can spread via contact in a sexual way. The symptoms include painful urination, unnatural mucus discharge, and painful sexual intercourse. Unlike AIDS, chlamydia and gonorrhea can be treated with various methods. Steve Zajonik also goes to describe that the best birth control method to prevent STD contraction is the condom. The condom is usually worn by the male and prevents any sperm or genital mucus from transferring bacterial or viral sexually transmitted diseases. According to the author, James Balls, teens do not believe that condoms are necessary and therefore do not use them. In actuality, it is very important to use a condom every time sex occurs. This also applies to young teens in relationships. In conclusion, teens must be aware of the consequences of sex. Even though young teens may feel invincible, they should find out all the facts of sex before indulging in it. It is important to not give in to unreliable myths because they are nothing more than folklore. Rather, teens and parents should always consult a local doctor to know the true facts. Another important tip is to not go on the internet for information. There is a lot of false information concerning pregnancy and STDs, being that information can be written by anyone, anywhere. Young teens should talk to a parent or a doctor before having sex. That way they can be directed to the right contraceptive for them. For more information on pregnancy and STDs, check out the website www.cdc.gov and click on Pregnancy and STDs. For more information on the right birth control method for you, please talk to a local health official. They will take blood work and be able to pinpoint the right method for you and your body.